Spartanburg Regional's Home Health Services is using a new device called telehealth. It's installed in the patient's home to daily monitor their medical condition, like heart failure. Regional Home Health Director Phyllis Osborne explains.
With this equipment, what we're measuring is actually their blood pressure and their pulse and their weight. And those are transmitted through a telephone line in their home, and then comes to our office in home health, where a registered nurse is monitoring that data. It keeps the patient out of the emergency room, and it keeps the patient in better health so that they can have a better quality of life.
Can you hear it, that crackly kind of sound? Yeah, good.
StimMan actually talks to you. You can hear his heartbeat. You can take his blood pressure, feel his pulses, Instead of the instructor telling you in class, well, this is what you might hear if a client has this disease, you'll actually get to hear it on the SimMan. Basically, it's a mannequin that the nursing students can use to practice taking vital signs, blood pressures, and the instructors can set up a scenario that your client has blood pressure, has a racing heartbeat, he has chest pain, or he's having an asthma attack, and you have to assess the situation and kind of know what's your first step. They can take you through these different simulated situations and to hopefully prepare you in the clinical setting better.
Visual DX Visual Diagnostic Decision Support is an innovative clinical resource that gives physicians and healthcare providers immediate access to specialist-level expertise. Visual clues are essential to accurate diagnosis. Yet, how do clinicians distinguish among common diagnoses or diagnose a rare disease they've never seen? Medical atlases, Google searches, and text-only databases are organized and searched by diagnosis, a time-consuming process of consulting, indexing, and cross-referencing multiple resources. Visual DX is organized by symptoms and other visual clues to lead to a rapid, highly structured differential diagnosis. It leaps beyond current resources to give instant access to specialist-level diagnostic help directly at the point of care. The system integrates key clinical information with the world's largest collection of digital medical images. Its unique findings-based search platform retrieves highly targeted, patient-centered results, increasing the quality and efficiency of patient care. DX marks a new era in clinical process. It's the only system that visually integrates knowledge based on actual patient factors and has the potential to improve diagnostic accuracy by a significant measure.
Hi, we're going to talk about iChart, an amazing new application that allows doctors and healthcare professionals to track patients. You can track patients at hospitals or your office using different filters or settings. You can search by outpatient, by patient name, or by site, say for example one of the hospitals or clinics you practice at. Once you select a patient, you can look at details on that patient. For example, you can look at their demographic information, you can capture a photograph of the patient. You can also make phone calls directly by tapping on their phone number. Alerts and messages can be communicated from your front office via a web browser-based product that we offer that comes free with the iChart application. Labs and studies are collected using a standard input form, and you can then modify them or track them using the built-in screens. You can track medication lists and prescriptions by setting medication lists for a particular patient using the built-in forms. They're all based on a mobile PDR lookup. You can look up the details on that particular drug, and when you write the prescription, it'll pull from that database. Notes are one of the most powerful features of the product. You can actually create notes very quickly using a point-and-touch system. You can also use voice, but we'll show you first how to do point-and-touch. In an upcoming version, you'll be able to actually annotate that particular point-and-click note using real-time voice recognition through a third-party partner that we're engaging with currently. This is a very efficient way to add non-templated text to your note, and that'll be offered as an add-on service option. Vitals can also be added very easily by using the built-in Vitals control. Simply tap on an option, select from the number pad, save, and it will actually graph or trend that vital for you and insert it into the note. Care plans are a lot like the note sections we talked about earlier, except they are based not on a complaint but on a diagnosis code. You can also annotate images that are built into the note, or you can add new images from the camera or from your iPhone list of images. You can zoom in, you can then use your finger to draw on those particular images, and those annotations will be saved with the note and displayed with the note when you save it to the online web application for printing.